transparency or compliance with record keeping and minutes taking in accordance with the Sunshine Law or Act. Now, why do I suspect this? Because I've spoken on radon testing on at least 4 of the last 6 months, and there was no mention in the minutes of the topic of what I was speaking on. On January 20th, 10 people spoke on different topics. They're all listed under the health and safety plan. So there's no way of knowing whether they were for or against the health and safety plan. 2 people spoke on the head football coach. We don't know what that was about. On December 7th, Citizens Speak, there was none, but I'm pretty sure I spoke on radon. On 11/18, Citizens Speak agenda, Dennis Smittle, they listed me as honoring the school board, which I did, and then I spoke on radon. General items, Dennis Smittle spoke on the health and safety plan. Well, it was on radon. Testing, radon testing. Ann Thomas and Ann Miller spoke on vaccination clinic, but we don't know what that was about. Carissa Boyer spoke on mask and the right to know, and I understand where she's coming from because I submitted a right to know, and the response, I got a denial based on there's no records. Well, there again, it's record keeping. That's the responsibility of everybody. When I worked for the state 35 years, if you didn't document it, you didn't do it. So why don't you just come out and say you didn't do radon testing? Then it goes on, 10/28 Citizens Speak, Dennis Smittle spoke on education facilities. Well, I did, but what I spoke on was the lack of providing efficient educational facilities, because if you don't know your radon levels, how can you make the claim that you're providing efficient education facilities when you don't know what the quality of the air that the students and teachers are breathing? General items were about SHOP, USA, NPFH, class discipline, and dress code, but we don't know what that was about. 9/21 Citizens Speak, none. 8/19 Citizens Speak, none. But that was the big meeting where a lot of people spoke, and letters that were submitted were listed. So I give you credit for that. And Mr. Andrews stated that that was their way of complying with the Sunshine Act. I'm not singling out anybody, but I think it's a systemic problem with Canon-McMillan School District. And that's all I want to say at this time.
All right, thank you. We will certainly look into your concerns.
I appreciate it. If in these minutes you would list the topics, not just citizens speak.
All right, student reps. They'll be here next week. Okay. All right, Mr. Davis.
I'm sorry, I signed up too.
Oh, I'm sorry. Okay.
That's all right, I didn't know the passing around. Okay.
You want me to take these?
No, it's fine. Ann Thomas is, I'm on the list. Good evening, thank you for the opportunity to be here. Got 2 items tonight. The first one's the easiest, probably for the 4 of you that I think are on the athletic committee. This has been on my mind through many Canon-McMillan sports seasons. And now that I've run into a snag with my 10th grader participating in 2 spring sports, I thought it was time to bring it up. So the athletic handbook for the district that's loaded online is woefully outdated. I think the updates are somewhere between the 1970s and to 99. Now to me that doesn't seem like that long ago, but obviously that's a long time. Those are the dates listed in there. There's a lot of redundancy, a few contradictions. I just think it would be a good idea if we would look to revisit that and maybe bring some consistency. I think there's been new sports added that, you know, aren't mentioned in there. And I know with our family's current situation, it would have been a good guide for us to know kind of how to take the next step in our situation. So I just respectfully ask you to consider taking a look at that. The second topic's a little bit more general, but also what I consider more significant. These days, there's lots of different initiatives being proposed nationwide, Pennsylvania-wide, school districts near us and within our own district that seem to be trending toward decisions and activities and programs in the district that want to seemingly replace parents. We've certainly seen it the past 2 years in terms of some medical related decisions on behalf of students, bringing providers into school buildings with our kids. And now we're starting to see it in terms of nice flowery language describing programs that are being introduced. Everything sounds so good and nice and warm and fuzzy, and yet every step with these kind of programs takes us further away from actual education of our children. So I just want to mention a few phrases to listen for as you come across and consider some of these behavioral programs. Phrases like safe spaces, mindfulness, which is directly opposed by many for various religious reasons, school-based medical and outpatient services, social emotional learning, which is not the same SEL as we knew it to be just a handful of years ago. The point I just want to make is that just because other districts are looking at some of these programs doesn't make it the right decision for our district. And just because a group thinks they're a great program or very nice sounding program, I'll use that word, just because it sounds like something good doesn't make it the right decision to be continually usurping parents' decisions for their children. Just because a program sounds nice doesn't mean that it is. I just ask you to keep that in mind as you're continually going to be bombarded with program requests, suggestions for your consideration. So thank you for your time tonight.
Send me a copy of your tape.
Sure.
Okay, so if you remember, last month I spoke to you very briefly about how we are going to be moving forward with a show project beginning at the start of next school year, which does address social emotional learning for our students, our staff, and our parents. And that I told you, I just very briefly gave you a very quick introduction to it and said that someone will be coming along to share more with you. So I just would like to introduce Mr. Will Davies. He is the director of the show project, and he will be explaining a little bit more about what this is. So it's up to you. Take it away.
So it's my pleasure to introduce a program to you. And I can tell you that from the perspective of Allegheny Health Network, as we present this evidence-based program, we have very high respect for everybody in this space and respect for parent decision as well as our program does. So just want to start off, about 2 years ago, back in 2019, we started this as a pilot, as a way to improve school-based behavioral health support services. And this pilot started in Baldwin High School. It also started in Pleasant Hills Middle School, just to see what would happen in if it would work, and hopefully, to see where we're at now. So now we're in 17 different schools, and we were contacted by Becky, and then before that, I had worked with Bob in some previous capacities, and really thought about how we can remake these types of services in a way that really support the modern mental health needs of our students. Sorry, I don't know who has the clicker.
That would be me.
All right. That's the boring slide. We'll go to the next slide, which just says we own that PowerPoint. Okay. So when you think about traditional school-based services, you tend to have other providers who are maybe in, there's one or two providers, one or two therapists in, a bunch of schools. And they're living out of their cars and they're bouncing around all over the place. It really leads to high burnout and turnover for those therapists. There's really not a great relationship that's formed with school professionals, with students. And so what you end up having is kind of a disconnect, right? And these providers have a really, really strong focus on just getting as many kids as they can on their caseload. So we don't do that. What we want to do then is take that and take a look at it a little differently. And I'm going to tell you what that looks like in a second. The other part of it is you have a traditional school guidance counselor structure where you have ratios of counselors to students that could be like 1 to 400, 1 to 500. On top of that, you have this incredible mental health crisis that we're having right now. We used to argue that there was a mental health crisis before this. COVID and everything has really exacerbated the mental health crisis as we know it. We know that it takes weeks to get into inpatient psychiatric facilities. It takes 6 to 8 weeks right now to get into a partial hospitalization. And what you have is this kind of chain reaction where kids with this very high acuity are now sitting in school when they should be in other higher levels of care. And so the teachers have to be with these kids, the administrators, the counselors, and you have this sort of perfect storm in the structure in a school that's kind of antiquated on top of this mental health crisis that can cause really quite a bit of a problem. And the structure that currently exists in most schools is just not supportive of these current, the current mental health crisis. So if you could click the slide, that'd be great. So we take a look at the school as a giant family. A lot of other providers just say, like, if you have a diagnosis, and you have insurance, then you're good. You know, sorry, too bad, see you later, right? So we knew that was a problem too. So what we do is we take a look at the school as an entire family, and we know in this family structure, you have students, staff, faculty, administrators, parents, and guardians, not just that little circle there, not just that one family member. And we know from family systems therapy that you have to address the entire family if there's a problem. It just can't be that one person. You don't exist within a vacuum in that entire space. Everybody can learn something. So if you think of an MTSS model, what we have done is design this based off of that. It really aligns nicely with the multi-tiered structured support program. And if you think about the program in tiers, we have our first tier, which is our universal intervention, which we have one full-time person who is in what's called a chill room. We're going to show you what that looks like in a minute. In that first tier intervention, that person delivers and facilitates our custom-made evidence-based curriculum that we have designed off of evidence-based coping skills that we know are very effective in clinical spaces of reducing symptoms of depression and anxiety. These lessons that occur on a monthly basis also are facilitated to teachers as well in the form of professional development. Because what you have in the old model, kids would come back from therapy from class, and the teacher would have no idea what they're talking about. The kid would have a stress response to something, and the kid's like, I'm trying to use my grounding techniques right now. The teacher's like, I have no idea what you're talking about right now. Like, go back to the principal's office. I'm super frustrated with you. So now we start to have this common language. The teachers are using it for themselves. They're getting well. And then tier 2, when they're not facilitating those evidence-based lessons, they are open for walk-in sessions. So that is continued psychoeducation. It's not therapy. They're continuing to learn these skills. They're continuing to have these skills being reinforced in the space. And then we hit our tier 3, which is a second person. So that's, just want to make the distinction that each school that we're in has 2 full-time people. So you have the full-time person who's in the chill room, who does tiers 1 and tier 2, and then you have the full-time person who is in a therapist office in the school doing school-based therapy 5 days a week, which is hugely different than the models that exist prior. So what can happen here then, if students need more support, they get referred to outpatient, and then we have a virtual intensive outpatient program through Allegheny Health Network. If the student needs further support, they can be referred to that IOP, and our folks can help with case management if a kid needs to go to the emergency room, if a kid needs to go to inpatient hospitalization. Go to the next slide, that would be great. So the chill room, we try to have it very distinctive looking. We want it to be a space that's very warm and inviting, not looking like a classroom in a traditional space, a place where kids want to come in and talk about what's going on and process things. So we have multiple spaces within that chill room for multiple small groups of kids that need assistance or structured time, and and we also involve the students in what we do. So the picture on the bottom right, that's a little nook that we have at Baldwin High School, and we involve the students in creating a mural in the classroom, things like that. We have like custom trees and different things that we've made to kind of pull the kids in, to make it warm and inviting, and to kind of reduce the concerns around mental health stigma. That it's okay to not be okay. It's okay to talk about these things, and that we know that in order for your academic health to be its best, we also have to talk about your mental health. We talk about your physical health, we talk about your mental health, so you can have great academic health. So if we can go to the next slide, that'd be great. So that's really fine print. Sorry about that. We also take a lot of data. And we make sure that The students who come into our space are tracked. We have constant communication with the counselors, with principals, and the students who come in, we kind of like parse it out by why they come in, what the concerns are, and if we need to make a referral, if we have high flyers in that room, but we're always having constant communication. Something that I think is really also special about this is that we're very flexible. We're not like a program in like a microwavable box, right? We're not a dinner, like a microwavable dinner. Like there's flexibility to create new programming in the moment. So for example, like Baldwin High School is a great, just talk, because we're talking about them. They have a preschool that's situated in the high school, and we've pushed in and helped the seniors who are doing like an internship in there with social emotional concerns that like 3 and 4-year-olds might have, and how they can help support their needs. We've also had sports teams come in. Baldwin cheerleading team went to nationals one year, and they were really anxious and concerned about going up on the stage in Orlando, and so we worked through some activities and some coping skills that they could facilitate while they were there. And I think they won like 2nd or 3rd place, so of course we take credit for that. So if we could go to the next slide, that'd be great. So we all, and this is just another way to track it. This is Northgate Middle High School, which is one of our other schools that we're in, and you can see, how we track the data, just so, and this is always very open and available to anybody in the school. We also put out a mailer to parents that make sure that everybody knows and understands what this is.